Welcome back to my show, Time with Dr. Nita. This is a show where we talk about women's health, our day-to-day health activities, problems that can arise, and ways of solving them. Baby weighs about 1 kilogram by the 28th week. There are certain changes in the mother as well at this time. You'd realize that you begin to have a lot more cramping in your hands and in your legs. Some people complain of numbness in the hands especially. This is because there's a sheath around your wrists. That's where all the tendons, the blood vessels, and the nerve pass through. So in general pregnancy, you get a little bigger and this sheath does not expand. So when your hands get bigger with the tight sheath, that is when you feel the numbness in your hands, and it is very normal. After pregnancy, when all the edema and the swelling goes down, everything will go back to normal. This is also the time that you need to get your kids' room ready. If you haven't bought your cots, you need to buy it. You need to buy clothes, you need to buy diapers, and all the stuff that the baby will need in preparation for the birth of the baby. You also start thinking about your maternity leave. You may need to talk to your employer. And then you also start thinking about your birth plan. Which kind of birth plan? Would you need a vaginal delivery? Would you need some form of pain relief? There are several forms of pain relief. We have the epidural, we have the labor analgesia. You need to discuss all these with your gynecologist or your obstetrician, and then they would arrange for that when you go into labor. Are you having a cesarean section? If you are having a cesarean section, what are the preparations that you may need to do in anticipation of this cesarean section? The baby would also begin to move a lot. At this time, if they are still breech, it doesn't really matter. As time goes on, most babies will turn and bring their heads down. By the end of the pregnancy, only about 3% of babies remain as their breech position. Majority of them will turn and bring their heads down. So if you are told by your provider that your baby is breech, do not worry. As time goes on, this baby may turn. At this time also, when you visit your doctor, they will have some checkups for you. Blood pressure measurements, blood sugar measurements, urine checks. We check for protein, we check for sugar in your urine. They are all very important because of certain medical conditions that may happen when you are pregnant. Diabetes mellitus, hypertension, and other kidney or liver problems that may happen when you are pregnant. Because of this, we check all these when you come to the hospital. This is the time also for you to discuss breastfeeding with your healthcare provider. Certain diseases require that we make specific inputs into breastfeeding. Diseases such as HIV and hepatitis B. The woman would need to discuss with her healthcare provider whether she is breastfeeding exclusively or she's not breastfeeding. This time also, you may be able to breathe a little more easier as the baby settles down. The baby moves more into the pelvis and it's called lightening. Even though chest-wise, the heartbeats will reduce, in the pelvis, you experience a bit more discomfort as the baby goes down, and then sleep becomes more difficult because you feel heavier, and then you're also anxious about the birth of your baby.